I'm sure you've heard that there is an antibiotic shortage at the minute, specifically with children's antibiotics and the liquid form of them. And I want to reassure everyone that doctors and pharmacists are working very closely together every day to ensure that alternative prescriptions are given in the case of antibiotics that may or may not be in supply, and the doctors are writing prescriptions like this. And that also there is an option that patients can give their children a solid dose of an antibiotic, such as this. This is 250 milligrams of amoxicillin. And parents can do this and give this to their children in a really easy to take way. So in the case of a capsule, all you need to do is open up the capsule as such. So open it up with the fatter part at the bottom and open it into a little spoon of jam or some sweet tasting cordial that you know that your child will drink, a small amount so that you know that they're actually going to take it all. So what you do is, that's the capsule open, you see, and the powder's inside it, and you just tip it into the jam like this. Make sure it all goes in. You would mix it really easy. You make sure it's very sweet tasting. It could be Nutella, jam, honey. It could be a small amount of my waddy or a smoothie. And then you simply give it to the child like that. And that's a way of getting the solid dose into the child if it comes in a capsule form. Now, if it doesn't come in a capsule form and the antibiotic actually comes in a solid tablet form, or even if it's not, if you've been prescribed the prednisol, so this is the prednisol, that's usually dispersible, but it's in short supply at the minute. So your pharmacist may have to give you the 5 milligram tablet version, which isn't dispersible, but I'm going to show you a little trick. What you can do is you can get a syringe from your pharmacy and you just pull it open. What you do is you pop the tablet into the syringe, like so. You kind of wedge it down, okay? And then you take some water. I've forgotten the water, I'll get the water. You have the water now. And you simply push the plunger down with the tablet in it and you suck it up. So suck the water up into it, and then you simply give it a little shake, turn it, swirl it like this, and it will disperse. It might take a little bit longer for some tablets than others, depending on what way they're made, but it will disperse within a few minutes, and your erythromycin tablet will eventually look like this. Now it's kind of like a suspension, but it just means that you can easily squirt it into some yogurt or some jam like what I used before. Give it a little stir and give it to your child like that. That means everyone gets their dose that they need, their medication that they need, and then hopefully this shortage will resolve itself very soon. But I just wanted to really reassure you that there are always alternative antibiotics that can be taken and given, and that there are always different ways to take the medicine so that your child is looked after appropriately.